Hey, well, thank you everyone for joining us for today's University of Idaho, University or South Dakota State University and Utah State University Sheep and Goat webinar series. We're glad to have you join us along with some of the speakers that we do monthly. Remember that this is every second Wednesday of the month if you would like to join us or tell anyone about it. First, we'll hear from our collaborator, Carmen from the University of Idaho. We'll go ahead and we'll get things started and have Carmen take it away with her talk about understanding some of the new antibiotic rulings. So go ahead, Carmen, and thank you.
Great. Thanks, Chad. So like Chad said, I'm Carmen Wilmore. I'm with the University of Idaho Extension located in Bingham County, which is on the eastern side of the state. And this afternoon, I'm going to talk a little bit about the new antibiotic ruling that will be coming into effect in almost exactly 1 month on June 11th, is when this kind of takes place. And so this is just kind of some background on why this is happening and what we as producers need to know moving forward. Oh, let's see if I can get my slides to move. Okay, there we go. So a little overview of antibiotics. The first antibiotic was penicillin, and that was just discovered in 1928, so almost 100 years ago. At that time, it didn't become widely used until about 1945 in human medicine, as they were kind of experimenting and trying to figure out exactly how to use it in the best and safest way. At that time, antibiotics were considered wonder drugs. They were able to treat things that had never been treated before. They were able to prevent a lot of things that at the time were, very deadly to both human and animal medicine. And so they were pretty fascinating and very, they weren't well understood, but they were used pretty commonly. And at the time, that increased life expectancy at about 20 years. So just with the introduction of antibiotics and the diseases and kind of issues that they were able to treat, it was a huge gain in human medicine. So the 1950s, 60s, and 70s was kind of the golden age of antibiotic discovery. There were a lot of new antibiotic strains and bacteria that were able to be used as antibiotics at the time. But since then, in the past 50 years, no new antibiotics have been discovered, and only modifications of those existing antibiotic strains are kind of what's being put out on the market today, and in new products are just modifications of those original strains. So with the discovery of these and the use of them over time, it has developed antimicrobial resistance. So we kind of know this, that antibiotics become less effective over time, and that's through natural selection and survival of the fittest. So as you treat, an animal or something else with an antibiotic, that's going to fight off the bacteria that are causing the sickness, the illness, but some of those bacteria are going to survive. And in their survival, they will develop antibiotic resistance. So they are able to have a certain, trait about themselves that they are not affected by that antibiotic, and then they proliferate and pass that on to their offspring. And so that's kind of how antibiotic resistance has developed. In the past, a few decades, antimicrobial resistance is becoming a crisis in both human and animal medicine, as some of the products that used to be, used and very effective are losing that effectiveness because of this resistance. And so this has resulted in more government oversight and more kind of management of these products so that they can be used for, longer periods of time. So a little history on this antibiotic ruling and the oversight of these products. So 20 years ago in 2003, there was GFI number 152, which was the evaluation of the safety of antimicrobial animal drugs with regards to their effect on bacteria of human health concerns. So the FDA went through and ranked antimicrobials according to their importance to human medicine. So if it's something that we really have to have in human medicine, maybe that's something that we're not going to be using in animal medicine, so we don't, end up with more resistance, and then we're not able to use it in human medicine. And so at the time, that's what they were going to do. And then they were planning to regularly reassess those products and their use in both human and animal medicine, just to make sure that we're still able to treat both humans and animals effectively with these products. So in 2012, number 209 came out, and that was the judicious use of medically important antimicrobial drugs in food-producing animals. So all of this kind of led to the what we know as the VFD, the Veterinary Feed Directive, and that started in 2013, where new animal drugs and new animal drug combination products that were put into feed and drinking water of food-producing animals were going to be kind of coming under more management and align those with more recommendations by the the USDA and other organizations. And so that Veterinary Feed Directive took full effect in 2017. And so what that kind of did was anything that was being used, any antibiotics that were being put into feed and drinking water of livestock had to be prescribed by a veterinarian. And so they were still able, just like what this is doing, they were still able to be used, but with more guidance and more oversight by the veterinary community and those that work as veterinarians. So it was, you still can have it, but it's going to be more, stringent and more oversight by those groups. So that kind of led us down the road to where we are now in 2023 with this antibiotic ruling. So 2 years ago, in June of 2021, the FDA recommended that manufacturers of our medically important antimicrobial drugs voluntarily bring their products under veterinary oversight or prescription marketing status. So just like you and I have to go to the counter at the pharmacy to get our antibiotics, they were asking more of the manufacturers in animal medicine to do the same thing. Now, 2 years later, we're at the point where that is what it's going to be like. So that's going to be our new world. So they'll now have a label on an antibiotic product where the prescription labels of remaining over the use or over the counter antibiotics for livestock will be required, and the purchaser must have a prescription in order to purchase it. And so in June, all of the antibiotics that we will be purchasing will have this label that says, "Caution, federal law restricts this drug to use by or on the order of a licensed veterinarian." So what that is saying is, for you to administer that product to your livestock, it needs to be under prescription of a veterinarian. So a lot of people, a lot of ranchers and producers that I've talked to have asked, like, why do we need to do this? Why has this come to this point? And it is the effort by the FDA to combat this antimicrobial resistance with more oversight of these products and more involvement of veterinarians when we're administering these to our livestock. The hope is that we can use these products for longer times. And so we're using antimicrobials judiciously, can also help slow the rate of that resistance. And you may have noticed over the past few years that a lot of the newer products like Res4, New4, and Draxxin are not available in farm stores. And to get those products, you already have to go to your veterinarian, get a prescription, and order it through them or pick it up at their office. So why would I need to consult with a veterinarian for something I have always used? And this is a question I've gotten quite a few times. People, I've been treating my animals the same way I've been treating them for years and years and years. Why would I need to change or call the vet to do it now? And the reason for that is our veterinarians are here to help us guide the judicious use of these antibiotics. It is their profession to know these products, how they should be used, and if there's a better product out on the market that maybe we don't know about yet, that they could recommend for us to use. And sometimes our antibiotics are not the most necessary treatment. And you may be used to giving LA200 every time you see some pneumonia or a sore foot or something like that, but maybe the vet has a different idea of what's going on and might be able to give you a different treatment plan. So we want to make sure that we're using the best product the first time to reduce chances for multiple treatments and resolve the infection more efficiently. And we should be able to do that with the use and the help of our veterinarians. So this is kind of a short list of the products that'll be removed. So our oxytetracyclines, penicillin, tylosin, and a lot of the sulfa products. And this is kind of a little bit of a longer list. So like I said, our LA200, LA300, penicillin products, sulfa-based antibiotics, tylosin, and then also for people with dairy, sheep, and goats, very important to realize that our intramammary tubes, so those products that we give during dry off, or if you have a mastitis issue, those will also be under veterinarian prescription. So you'll need to be working with your veterinarian to get those products to treat your livestock. You won't be able to just get them at the farm store anymore. So how are we going to go about getting these prescriptions from our veterinarian in the best way possible, and also kind of making sure that we're doing what we should be in using these products? And that is through a veterinarian client-patient relationship. So this establishes the veterinarian's responsibility to make clinical judgments of your animal's health and their need for treatment. And then the client agrees to treat that animal as instructed by the veterinarian. And that's a very important part of the relationship. You need to make sure that the veterinarian that you choose to work with you and your livestock is someone that you trust and you respect, and you're willing to do what they ask you to do, and you're not going to, not listen to what they have to say. And so part of this relationship requires the animals have been seen by the veterinarian and are aware of their general management practices. So this relationship has 3 requirements. First, by the veterinarian, they have assumed the responsibility for making those judgments regarding the health and need of medical treatment. And then the client agrees to the veterinarian's instructions, like I just said. The veterinarian needs sufficient knowledge of the animal to initiate at least a general or preliminary diagnosis of the animal's medical condition. It means the veterinarian has recently seen and is personally acquainted with the care of the animals. By examining that animal or medically appropriate timely visits where the animal is kept. And this could look like having there's a lot of veterinarians that will come through kind of on a rotation basis. And you can be part of their, that rotation where they come out, do a herd check, maybe twice a year. And they know how your animals are cared for, how they're fed, what your vaccination, other management protocols are like. They need to have that knowledge of how you manage your livestock so that they can help you make treatment plans in the future. The veterinarian also needs to be available and have arranged emergency coverage and follow-up evaluation in the event of an adverse reaction. So maybe if your veterinarian is not within 15 to 20 minutes of your location, they need to at least be able to make an emergency call with you and do some type of evaluation if something starts going wrong. If you give a product and the animal doesn't respond or has a negative reaction to it. So what will change for us as producers? If you already have that relationship with your veterinarian and order product through them or use them through a prescription status with a pharmaceutical company, not a lot is going to change. You can continue doing that as you have been. If you are accustomed to picking up your pharmaceuticals from a local feed store, they will no longer be there as of June. And so you will need to develop this relationship so that you can still get your necessary products through a veterinarian. So a couple more questions that we've got is, can I stock up now? That is not recommended because these products are pretty expensive They do have expiration dates and they can be sensitive to storage. And so I would not recommend going and buying everything off the shelf thinking that you're going to use it before it expires, because hopefully you're not having to use that much. And also they don't store for as long as you might think. And also if you're using them and pulling them out and in, and it is not recommended to go out and buy a lot right now. Distributors may require proof of prescription either through a direct contact from a veterinarian or in written documentation. So that's kind of what it will look like in the future, where you should still be able to get them. In our part of Eastern Idaho, I've been asking around at the feed stores and kind of veterinarian stores, and a few of them are working through the state to get a license to be able to still have these. And then the veterinarian's going to call them in, say so-and-so is coming to get a bottle of, Draxxin or whatever it might be. And so you can walk in, tell them your name, and be able to pick up the product that way. Just like you would if you went to, a regular pharmacy for human medicine. Your doctor calls in the prescription, you show up and it's there for you. And so that is ideally what this will look like as things kind of come into place. So what are you still able to get without a prescription? Most of your vaccines, dewormers, injectable and oral nutritional supplements, ionophores, pre and probiotics, and any topical non-antibiotic treatment. So most of your products that you're using, you'll still be able to get. It's just these antibiotics that will need the prescription. A really important to think about is that our antibiotic products are needed. We want to be able to have them and hopefully have new products and things like that in the years to come. So we need to make sure to use them according to the label, administer them how they are intended. So if your veterinarian says to give it as a sub-Q injection, give it as a sub-Q injection. Don't try and do an intramuscular injection or do like an oral treatment when it shouldn't be given that way. So do what it says and use the proper dose and duration as well. Again, if your veterinarian says you need to give 5 cc's for 4 days, make sure to give that on the 4th day. Even if they've responded and they've started to turn the corner and look really good, they still need that 4th day to help fight against this antibiotic resistance. Because I think most of us understand when you get an antibiotic from a doctor, you need to take all of the antibiotic that they give you so that you fully kind of fight off the bacteria, so there aren't those resistant bacteria that are able to proliferate if you don't take it on those last few days. So make sure to follow the instructions. Withdrawal times can change and effectiveness is not known if used off-label. So again, especially with sheep and goats, we're getting more products that have sheep and goats on the label, but listen to your veterinarian and follow their instructions. We have great antibiotics, so let's not abuse them so we have them, for many more years. And remember, antibiotics are not the only answer. Make sure to have vaccination history. Antibiotics only treat bacteria, but vaccines can help prevent those viral diseases. Nutrition is always a really important thing. Strong and healthy enough to mount an immune response. If your animals are not being, meeting their requirements nutritionally, they're not going to have as much strength to fight off any immune, threat that might come. So nutrition is always a very important part of that. And then your management of them and genetics as well. And just remember, the best treatment for disease is to prevent the disease. So in summary, this change will be happening on June 11th. All antibiotics will need to be purchased, again, through a veterinarian. So make sure to establish that relationship now to make the transition easier, so you're not calling in an emergency to a veterinarian that doesn't know you and has never seen your animals, hoping you can get a product. You should start that relationship now, so when you have a concern or an emergency, that they're there to help you. Might be a good time to start reviewing those herd health protocols, especially that'd be a great way to start a relationship with a veterinarian, is to call them and say, hey, I have a herd of sheep or goats, whatever it is you have, and ask, what vaccinations they recommend and what time of year you should be giving them. If there's anything in your area that they know about that maybe you're not doing at the, at the point in time. Also, wormers is another part, especially going into grazing season for a lot of us, to just keep those things in mind. And that's a great way to pick the brain of that veterinarian, build that relationship, and they can also come out and see your livestock and how they are managed. And then always use medications responsibly and to follow your label directions.